Hello, this is a short revision video about the thyroid system drugs used for both hyperthyroidism and hypothyroidism. So basically, if you remember from physiology lecture, the hypothalamus releases the thyrotropin releasing hormone, the TRH, and then the TRH activates the thyroid stimulating hormone, which is released by the pituitary, especially the anterior pituitary, which also activates the thyroid hormone. The thyroid hormone synthesizes thyroid, the T3 with the triiodothyronine and the tetraiodothyronine. These two hormones, the T4 is basically converted in the periphery, especially more than 80% of the T4 is converted to T3. T3 goes to the nuclear receptors, and the nuclear receptors result in change in metabolic rate. So there's increased metabolism in hyperthyroidism and reduced metabolism in hypothyroidism. So and usually the way it's diagnosed, it's high thyroid stimulating hormone and low T4. It basically means hypothyroidism, because remember, if the presence of thyroid stimulating hormone is suppressed if there's enough hormone, but the fact that there's high TSH and low T4 means there's a thyroid gland problem. And for hyperthyroidism, if there's low TSH and high T3 and T4, it means hyper. There are a lot of tests, very complex, but you could check that. And remember, only the free T3 or T4 is active. Um, because the thyroid hormones are highly protein bound. So drugs which displays the thyroid from the protein binding, like phenytoin, could result in increase of T3 or causing hyperthyroidism. Um, and this protein is called the thyroid binding globulin. So the thyroid hormone is very important for normal development, growth, also regulating metabolism. It's also very important in infants who have hyper or hypothyroidism. And this is basically what we said earlier. And also, one of causes of hypothyroidism include Graves' disease, which is an autoimmune antibodies which activate the thyroid gland, resulting in release of more T4 and the ultimate conversion to T3, causing all symptoms of headache, flushing, fever, sweating, weight loss, or basically it's increased metabolism. And opposite to that, there's this is called the diffuse non-toxic goiter, which basically causes hypothyroidism as well, and it's the opposite of hyperthyroidism, um, resulting in cold intolerance, weight gain, constipation. So basically, this is opposite this. So it's important to do an ECG test before the start of any treatment for hypo or hyperthyroidism, and they could mess with the synchronized beating of the heart, causing atrial fibrillation and angina. And also causes high cholesterol. So correcting hypothyroidism itself could result in the normal cholesterol level in the blood. So just remember, hypo just means very slow, and hyper means very fast metabolism, which is very easy to remember. And then treatment just for drug. Just remember propylthiouracil and crabimazole, levothyroxine, and liothyronine. Liothyronine is more potent than levothyroxine because liothyronine is T3 while levothyroxine is the T4. So T4 needs to be converted to T3 to be used in the blood, but liothyronine is rapidly metabolized and only used in emergencies. Otherwise, it's not as stable. Not stable. It's highly active but metabolized quickly. The carbimazole is used also in the block and replace regimen, and also for maintenance treatment for hyperthyroidism. And the propylthiouracil is also used as a maintenance, although the carbimazole is usually preferred. And then side effects, both of them cause hepatotoxicity and agranulocytosis, which is a decrease in white blood cells. Especially the agranulocytosis is more associated with carbimazole, although the propylthiouracil cause the granulocytosis, and the hepato is mostly associated with the propyl, although the carbimazole could also cause hepatotoxicity. So if you see all these symptoms, it's very important to educate the patient to report these. And then the side effects for the thyroid hormones for the levo and the liothyronine, basically it's the hyperthyroidism symptoms like diarrhea or fast heartbeat. So if you want to know the side effects of levothyroxine, liothyronine, just check up symptoms of hyperthyroidism. And then you need to be aware of these drugs. Lithium amiodarone cause hypo, and rifampicin causes fast breakdown of levo and liothyronine because they increase their metabolism. And then both propyl and the carby can be used in pregnancy, but radioactive iodine is not is contraindicated in pregnancy. The dose titrated at the start of treatment, then every 4 or 6 weeks there's a checkup to see if the treatment is working. So if you start with 25 microgram levothyroxine and it's still low, then you increase to 50 microgram and then to 100 microgram. Or if it's too high, then you reduce the dose. So there's frequent monitoring. The plug and place is basically you give 40 to 60 milligram carbimazole plus 100 to 150 microgram of levothyroxine to basically suppress the thyroid stimulating hormone, and then replace with thyroid hormone as a levothyroxine to maintain normal metabolism. This regimen is not suitable for pregnancy because um, because of the risk of hyper or hypothyroidism in the fetus. And then if there's a medical emergency, especially medical emergency for both hypo or hyper, for hyperthyroidism, it's usually treated in hospital with propranolol. Propranolol is basically effective for reducing adrenergic symptoms like fast heartbeat, palpitation, sweating, and the hydrocortisone basically blocks the conversion of T4 to T3 in the periphery, and the chlorpromazine basically used to sedate the patient. The liothyronine is the first choice as IV because its action is rapid, and the emergency for hypo include basically administering levothyroxine.